Well, welcome to our Foundations for Understanding Immune Defense. I'm Dr. Carricker, and I just want to set the stage for the first mini lecture within the entire immunology unit. So the big practical question is this. If a patient's having trouble with infection, is the immune system not working well enough, or is it working too aggressively and creating other problems? So once we keep that framework in mind, the details of the immune system start to feel much more organized and a little bit more clinically useful. So when we begin our discussion of immunology, I think it helps to start from a practical lens instead of a long list of vocabulary terms, right? Think about a patient who's getting infections or a patient whose body is producing inflammation or allergy or autoimmune problems. The question we're asking is not simply, is the immune system involved? Because of course it is, but the question, or the better question, is how is it involved? Is the immune system underperforming or not protecting the patient well enough, or is it overreacting and causing damage? And so that idea will guide this whole lecture. Sometimes the immune system's too weak, which means the patient struggles to fight infection. Sometimes it's too active, which means the patient is fighting the wrong target, overproducing inflammatory signals, or damaging healthy tissue. So from the very beginning, I want you to approach immunology as a balancing act. The goal is not just to have an immune system, but to have one that responds appropriately. Let's get started. So this slide gives us a big picture map. The first tier that we're looking at in terms of the immune defense is a physical or chemical barrier. And that includes the skin, hair, cerumen or earwax, mucous membranes, cilia, and protective secretions. So these structures are doing more work than we often realize. They're not passive. They're actively preventing pathogens from entering, sticking, and taking hold. Now, the second tier is innate immunity. And this is the fast, non-specific system. It uses cells, proteins, inflammatory chemicals, and it does this to recognize broad danger patterns. And it tries to mount an early defense. And we can see from the figure there that it's in that first few hours when a pathogen is introduced. The body may not yet know the exact identity of the organism, but it still recognizes something foreign is here and it needs to be taken care of. And then the third tier that we see on the screen is adaptive immunity. And this is the highly specific system. It involves antibodies, cellular response, and immune memory. And the body essentially says, I've seen this before. I know how to respond more effectively next time. And if you look at the timeline figure, the key idea is that innate immunity carries much of the workload early in the first infection, while adaptive immunity takes longer to build, but becomes much faster on repeat exposure. And this is where we just consider the collection of tiers to help us better understand what a first exposure would look like versus a repeat exposure, where the immune memory now accelerates the response. And that's how we're going to refer to adaptive immunity. Now we begin to zoom in on the innate system. We'll start with macrophages. These are white blood cells, and their name tells you a lot. Macro means big, phage means eater, collectively big eaters. They phagocytose, or engulf, foreign material and break it down. And that's just one of the defense functions of innate immunity. But actually, they do more than just clean up, because they also engage in a process called antigen presentation. In other words, after digesting part of a pathogen, they display peptide fragments in a way that helps adaptive immune system understand what it's dealing with. So macrophages are not only first responders, but they also serve as messengers that connect the innate immunity to the adaptive immunity. Now, additionally, they also produce cytokines, and we're going to hear a little bit about those in just a moment. These are chemical signals that help coordinate inflammation, fever, and recruitment of other immune cells. So clinically, this is a good reminder that when we order something like a complete blood count, we're looking at a system with many different white blood cells, each playing a different role. And macrophages in particular are doing cleanup. They're doing communication and they're kind of coordinating all at once. So when a physician calls for a measurement of complete blood count, what's that actually include? Well, complete blood count tests measure red blood cell count, and that's the oxygen carrying capacity. They measure white blood cells, which fight infection. They're measuring hemoglobin, which is the oxygen carrying protein that's in red blood cells. They also measure hematocrit, which is the amount of red blood cells in the blood, and they measure platelets, which help blood to clot. So a complete blood count tells us a lot about what's going on in the body. Now, considering antigen presentation, bacteria have a certain component of proteins, and certain proteins are chopped up by proteases. And these fragments are brought to the cell surface for antigen presentation. In other words, we're going to show the adaptive immune system there's something we need to deal with. Look what I have. Here it is. Please take care of it. Now, finally, cytokines, the cytokine production. A cut, for instance, initially may not feel too bad, but 4 to 6 hours later, now there's some soreness, some redness, some inflammation. That area is being mediated by prostaglandins and the chemical process. Now, sometimes we have drugs like acetaminophen or ibuprofen that may stop prostaglandins from producing inflammation. And in some instances, fever may result in response to cytokines that are being produced because fever acts as a mechanism to kill the infection at higher temperatures. So we have a lot of things that are going on, but let's continue this discussion with cytokines. So think about cytokines as the major communication tool of the immune system. Now, most of the time, cytokines act locally, and they help nearby cells coordinate a response. But sometimes their effects can be more widespread, and fever is a classic example. Cytokines such as interleukins, interferons, and tumor necrosis factor, or TNF, they can stimulate prostaglandin production in the central nervous system. Now, effectively, this changes the body's thermostat. Core temperature rises. This is where we say, the person has a fever. They're fighting infection. Their rising temperature is not random. Many organisms don't produce very well at high temperatures, so fever can be part of an adaptive defense strategy. And that's why we don't necessarily panic every time we have a mild fever. A low-grade temperature of 100.5 degrees may actually be helping. The goal is not always to eliminate the fever immediately. The concern is that when fever gets too high, the patient feels awful or is not responding appropriately to treatment. And that also helps explain why medications like ibuprofen can reduce fever, because they interfere with prostaglandin synthesis. So on this slide, the major takeaway is that cytokines are not just abstract molecules, but they're helping create the very symptoms that patients feel. And those symptoms often reflect purposeful immune signaling. During a fever, cytokines can travel and cause synthesis of prostaglandins, and in the case of a rising core temperature, this is where Advil may be recommended to inhibit prostaglandin synthesis for maintaining what could be an out-of-control immune system. And that cytokine profile that puts out, this communication, and it illustrates the need to mount a coordinated attack. So in the brain, there's a thermostat, and it can be adjusted. And we don't tend to worry too much if there's a fever, but when it gets too high, then we can have some complications and feel pretty crummy as a result. So we just be mindful that if the fever is, say, let's 103 degrees, and we're feeling awful, then we might have the physician recommend taking some type of fever-reducing medication, but not necessarily wanting to eliminate the fever because, again, a higher temperature is helpful in starting to fight the infection. So this slide has a lot going on, but it reminds us that cytokines are not neat one job only molecules. Different cytokines can overlap in function, and one individual cytokine can have several effects. Let's take, for instance, IL-6 or interleukin 6. That's a good example. It can contribute to fever. It can influence protein synthesis. It can stimulate the release of other cytokines. It can increase cortisol levels, support B cell growth, stimulate neutrophil production, and it can even play roles in exercise metabolism. So that overlap is important clinically because the immune system rarely works in a simple one signal, one response pattern. It works more like a network with multiple signals that can push in similar directions. A single signal can influence several tissues at the same time. And it's important to remember that exercise can alter cytokine behavior. So, for example, IL-6 rises with exercise and may help mobilize energy substrates for working muscle. So, immunology is not separate from physiology, but rather these symptoms interact. And the immune system is not sitting off in its own corner. It's constantly communicating with metabolism, with endocrine responses, and tissue stress. So, the main takeaway for this first segment is that the immune system works in layers. Physical barriers try to keep threats out. Innate immunity responds quickly when something gets in. And adaptive immunity builds a more specific and durable defense. So keep that timeline in mind because it's going to help you make sense of the rest of the lecture.